Everybody. Good morning. I'm Dr. Jyoti Patel. Welcome to my Facebook Live on dietary and nutrition trends in 2018. So my intention this morning is to just educate evidence-based published data on nutrition and what you should be doing to get healthy in 2018. So thanks for joining me this morning. So my program is going to be basically talking about the new U.S. reports on nutrition trends. So U.S. News and World Report comes out with the list of the top diets for 2018. So there was an overall trend in terms of plant-based nutrition. So if you're trying to be healthy in 2018, the tag term this year is plant-based nutrition. So why do people need to worry about nutrition? Well, there's a growing problem in our country with obesity and diabetes and heart disease and cancer and chronic diseases. Hi, Becky. And so in order to tackle these problems, we're relying on the healthcare system to do that. And what's really interesting is that people have started to embrace taking on the responsibility of their own health through nutrition. So this morning, I'm going to cover a few things in terms of what's trending in 2018 and what the top diets were that were recommended by U.S. News and World Report. So the top three diets, first of all, before we talk about diets, here's my points that I want you to take home today. 1, just eat healthy. 2, find a plan that works for you, includes foods that you love to eat. So, and that way, 3, you're more likely to stick with it for the rest of your life. Hi, Chris. Good morning. So just know that you want to eat healthy, but you don't want to exclude foods that you normally love eating. Hey, Susan. Good morning. Because if you do, you'll deprive yourself for a short period of time. So this is something that people do all the time. They follow these health gurus. They go on a fast or they go on a trendy diet. They do it for 20 days or 21 days. Hi, Purnima, Auntie. And so just know that that's not going to be sustainable. That's not good morning. That's not going to be sustainable. So stick to something that you know you love to eat. So if you're a grain lover, there's a plan for you. If you're a meat lover, there's a plan for you. If you like a high-fat diet, there's a plan for you. So find something that is nutritionally sound, evidence-based, healthy, and something that's sustainable. Okay, so that's my take home this morning, and then we're going to go into the details of what they found was beneficial in terms of studies. So the top 2 nutritional plans that came out ahead were the Mediterranean diet and the DASH diet. DASH stands for Diet Against Hypertension. So if you have high blood pressure, if you have heart disease, if you have diabetes, take a look at the Mediterranean diet and look at the DASH diet. So initially the DASH diet was designed for people with high blood pressure. Its basic premise is eat foods that are rich in potassium, magnesium, calcium, fiber, and protein. And so it goes through adding into your day 2.5 cups of vegetables, fruit, whole grain, and yes, low-fat, hello Susie, low-fat dairy was also included in this particular diet. So if you're one of those people that says, you know, I love plant-based diets, but I can't give up my dairy, take a look at the DASH diet. It also suggests that you go on a low-sodium plan. So of course that cuts out all the processing, the baked goods, the desserts, and all the junk food, of course. So look at the DASH diet if you have high blood pressure. Now, my all-time favorite is the Mediterranean diet. Now, the folks in the Mediterranean region of the world don't eat this way. I don't really know why they came up with that particular name, but, you know, it's great. It includes whole grain. Again, grain is not bad for you if it's whole grain. So look at the ancient grains, things like barley and even seeds like quinoa. Add those things into your diet. Beans, legumes, fruits, vegetables, seeds, nuts. And the Mediterranean diet doesn't recommend, hi Susan, doesn't recommend poultry, cheese, and chicken and meat. It recommends fish as your protein source, along with a little bit of dairy, a little bit of poultry. Good morning, Lisa. So just remember that you want to broaden your diet to include grains, fruits, vegetables. You want to include seeds, nuts. I hope you can hear me. I just heard my mic go off. Just give me somebody comment if you can still hear me. So you want to include those things. So the Mediterranean and the DASH, good morning, Alice. The Mediterranean and the DASH diet came out ahead. So if you're one with diabetes, high blood pressure, heart disease, this is the kind of diet that you want to look at. So look that up. If you're a patient of our clinic, we have those printed out. You're welcome to take a copy. Thank you, Chris. I was looking for somebody to tell me they can hear me. I am sitting outside, so if there's any background noise, sometimes it interferes. So just plug me if you can't hear me, okay? All right, so the number 3 on the list is actually what I do. It's called a flexitarian diet. I don't know if anyone's heard of flexitarian. If you've heard of it, let me know. But I was kind of like, oh, that's what I do. It's a combination between being a vegetarian and maybe adding in meat once in a while. So you're 90% vegetarian, and then a little bit of meat gets into your diet. I think, Chris, you probably kind of relate to that as well. So what is a flexitarian diet? You eat mostly plants. So you're eating fruits, vegetables. Thank you, Alice. I'm going to hold on to the stand. It looks like there's a breeze coming here. So you want to eat fruits and vegetables and beans and legumes. You want to do vegetarian days. There's no restrictions in terms of calories or counting or weighing, which is what I like. But you're just eating whole plant-based diet. And then if let's say you feel like you want to have a burger, or if you want to have some chicken, or you're going out for steak, once in a while you can add that in. So that's a flexitarian diet, and that came in 3rd. So that's also an option for people that are not wanting to give up, their grain, or not wanting to give up their meat, and want to eat in moderation. So the DASH diet, which is the one for diet for hypertension, actually gives you a calorie restriction of around 2,000, gives you exact proportions, and I'll let you know. I wrote some things down so I could be a little exact. They wanted you to do 6 to 8 grains a day, 4 to 5 fruits and vegetables a day. They wanted you to do less than 6 ounces of meat a day, and 4 to 5 times a week eat seeds, nuts, and legumes, like half a cup of cooked beans. So it was very strict. It was telling you exactly what to eat. If you're the kind of person that needs an exact meal plan, go to the DASH website, DASH. Look that up. It's good for hypertension. It gives you exact calories. It gives you exact amounts that you should eat. It also gives you a meal plan with sample diet. So if you like it, then it'll help you. The problem that I had with the samples that they gave you is that a lot of the things that they included, I wouldn't recommend. Now, the studies that they did on this particular diet were compared to the traditional American diet. So compared to the traditional American diet, these patients on DASH did really well. But if you're already eating pretty healthy, maybe you want to modify a little bit in terms of what they've recommended. Hi, Kelly. You go ahead and watch me later. It's not a problem at all. So the things that they included in their diet that I don't recommend, things like for fats, they recommended margarine. I'm really not a fan of margarine. If you're going to do a little bit of butter, that's perfectly fine. I'd stay away from margarine. They recommended canned fruits and vegetables. Again, it's better than no fruits and vegetables, I think, but I would rather you just not do the canned fruits and vegetables. Nothing nutritious there. Go with frozen if you can't keep fresh in the fridge. Frozen still maintains its nutritional qualities. Also, it recommended fruit juice. Fruit juice is very high in sugar. So if you're a diabetic, the last thing you should be adding to your meal plan is fruit juice. So just get that out of your head. That's not going to be a meal that I would recommend. So go with fresh fruit if you want to, go with fresh vegetables, go with frozen if you can, but try not to do anything canned or fruit juice. They also included things like whole wheat. Interestingly enough, that's the biggest misnomer in the market. There's nothing different about whole wheat and white bread. The glycemic index for whole wheat and white bread are both the same. White bread is 100 and wheat bread is 99. So what is glycemic index? Glycemic index is the index that tells you how high your sugar will rise when you eat that product. So if you eat white sugar, it's 100, and everything else is sort of a grade of that. So if white bread is 100 and whole wheat bread is 99, you're really not getting anything that's lower in glycemic index. So what do you want to go for? You want to go for whole grain. So if you're finding your bread, go for whole grain. See that they don't add added sugar to your bread, because bread is very sweet these days. They add extra sugar to it. So look at the labels, read the labels, get whole grain. They also included things like bagels and cereal, pita chips and unsalted pretzels in their diet, and I don't recommend any of those things. Again, it's processed, refined, white bleached flour. You should look at labels, read the ingredients. Don't add those things into your diet. If you're going to add grains, look for whole grain. Again, you can get whole grain pasta. Pasta's interesting too. People sort of nix out pasta when they're diabetic. It's actually a very good source of fiber and protein. And it's lower in glycemic index if it's cooked al dente like they do in Italy. So make sure your pasta is whole grain and cooked al dente. Okay, so what else can you do to lower the glycemic index of your foods? Let's say you do like to have a whole grain cereal. Maybe you add a cup of yogurt, not the sugary kind, but tart foods and sour foods actually will lower the glycemic index of your food. So pair your food with something tart like a vinaigrette, especially if you're adding fruit to your salad, and that's going to help decrease the glycemic index of your food. And again, that's the amount of sugar that enters into your bloodstream. So these are some simple tips. So if you're trying to be healthy and you're just starting from nowhere, you're like, you know, I am just 2018, give me some ideas. What can I do? Add 1 cup of vegetables additionally to your diet every day. So if lunch is your meal, grab a salad. If dinner's your meal, grab a salad or stew some vegetables or roast some vegetables or saute some vegetables. Just add vegetables to your diet. Start with positive behavior. When we diet or when we try to restrict ourselves, we're not successful because it's a negative behavior. If you can decide to add more vegetables or you could decide to add more water, you're more likely to be successful. So start by adding 1 cup of vegetables, then add 2 cups of vegetables. Then substitute a snack for a piece of fruit. Then remove that extra, drinks and sweetened beverages. Add the water in once in a while. Cut out the soda. Maybe you're drinking 4 cans of soda a day. Maybe you just do 1 3 times a week or 4 times a week. Cut back. So if you can't cut it out, remember Rome wasn't built in a day, so you want to start slowly and start to gradually get yourself back on a path of wellness. And reward yourself. Don't deprive yourself. Find a dietary plan that works for you. Add plants into your diet, fruits and vegetables, beans and legumes. If dairy is in your wheelhouse, look at the DASH diet. If you like a more Mediterranean setting, maybe look at the Mediterranean diet. If you're having a love affair with alcohol and wine, maybe the Mediterranean diet is good because they do allow you to add a glass of wine into your meal plan. And if you are suffering from fertility issues or GYN issues, if you have polycystic ovarian disease or you have endometriosis or you're having trouble with hormonal changes, there is a diet called a fertility diet that's on the list. And that's interesting. It's also plant-based. I thought that was kind of neat. It went over adding in good fats like avocados, seeds, nuts, and olives. It went over whole grains. Again, that's the term I want you to remember, whole grains. Plant-based proteins. People don't realize that protein also comes from plants. They think they just have to eat eggs and meat to get protein, but you can get tons of protein from plant sources. So look at that. And then, interestingly enough, for the fertility diet, they recommended whole-fat dairy. Whereas the DASH diet said low-fat dairy, the fertility diet actually recommended whole-fat dairy. So what was the overlying theme throughout this whole report? It was what we already know. You know, cut out the excess high-fatty foods, meats, fried food. Of course, we have too much sugar in our diet. So your pastries, your baked goods, your trans fats, your cakes, your frostings. Hi, man. Just know that you have to cut those things out, and that was the theme throughout each of those things. They did several studies. The Mediterranean diet was studied multiple times and came out ahead in lowering the risk for cardiovascular disease, heart attacks, lowering cholesterol, lowering blood sugar, and also helped with chronic diseases such as lupus and rheumatoid arthritis and inflammatory diseases. People who suffer from GI diseases, gastrointestinal inflammation, the Mediterranean diet's great for that as well. So think of anti-inflammatory diet and Mediterranean diet sort of being on the same platform. There was a diet on the list called the TLC diet. I have a lot of patients that come to me that have high cholesterol and they don't want to take a statin. because they know of the side effects and they don't like the idea of taking a cholesterol medication, but they want to do something to help lower their cholesterol. So the TLC diet, if you look that up, you'll find that it's called the Therapeutic Lifestyle Changes Diet, was geared towards lowering the cholesterol. And studies showed that it lowered the cholesterol 8 to 10% in 6 weeks. Again, it was a sharp cut in fat. A different trend is to eat a lot of fat. There's people that go on these keto diets where they're eating 70 to 80% of their diet is fat. And again, that might be a problem when you have such a large percentage of your meal plan being fat. But this diet specifically was cutting out the fats, the sat fats, keeping the sat fats to less than 10%. Keeping the cholesterol less than 200 milligrams in a day, and having a lot of grains, fruits, vegetables, beans, and legumes. You must see a trend here. Whole grains, beans, legumes, seeds, nuts, fruits, and vegetables. And then a little bit of light or lean meats once in a while, doing some vegan days or some vegetarian days. Okay, so that was an interesting one. One that I recommend sometimes for people that have heart disease. They have had a bypass, or they have a stent, or they've done a coronary scan and they have blockage in their arteries, and they want to do something aggressive to regress plaque. Yes, you can regress plaque. A lot of patients are shocked when I tell them that there are studies to show that diet can actually make the plaque go away. So one of the most famous physicians that has led the way in plaque regression is Dr. Ornish. And so if you look at the Dr. Ornish plan, it is aggressive, but it is really meant for those patients that want to regress plaque in their arteries. They may have had blockage in their carotids, or they may have had blockage in their arteries in their heart. So what does the Dr. Ornish plan suggest? In addition to eating more of a plant-based diet, he recommends no refined carbs, no oil. He cuts out all animal fats and caffeine. He encourages whole grains, fruits, vegetables, and fish. And I liked Dr. Ornish's plan because not only did he include nutrition, but his plan includes mind-body work. His plan includes managing your stress. He includes deep breathing, meditation, yoga. He also mentions spending time with those who you love and respect to garner their support for your success. So again, it's so important that when you're trying to get on a health kick, to find people that are already on a health kick and ride that wagon with them. Find that support within your community. Let's say you're not one to cook food at home. You're on the go, you're really busy, and you don't have time to prepare food. What meal plan did they recommend? Well, if you want to buy food, because a lot of people will just want to get packaged food delivered to them, there was a meal plan called the HMR, Henry, Mary, Roger, Human Management Resources. It's about $300 a month, and they send you a box full of food that they felt was not processed and not unhealthy, but gave the person the opportunity to eat a more healthful, portion-controlled, calorie-controlled, programmed diet. So if you want something like that, look up the HMR diet. If you're one to do better in a community and you want to lose weight, the program that actually came out ahead was Weight Watchers. So it's been around for ages. Most people know what Weight Watchers is. If you don't know what Weight Watchers entails, it's basically a program of community support. You have a group of people that meet maybe once a week, or online support. They give you points that translates to a certain amount of nutritional value. You have to eat within those points. And along with coaching and support and community, this program has been very successful in helping people with weight loss. So we talked about programs or plans, health plans, that help with cardiovascular disease, diabetes, inflammatory conditions, high blood pressure, fertility issues, and also weight. So if anybody has any questions specific to their own condition or any diet that they would have problems with, please let me know. I'm here. I'm happy to answer any questions. Again, we'll be ending soon, so if you have some comments later, I can continue to answer questions even through the comments, so no worries. Susie says, Midwestern meats also deliver healthy meals at a cost of about $5 to $8 a meal. Thank you, Susie. So again, there are lots of options out there, whether you buy Freshly, which is a local company in Scottsdale if you're in this area, or you do a blue ribbon, Food Berman, yes. It's a service where they deliver the food and you have to just assemble it together. There are so many options out there for pre-packaged, pre-prepared foods. It does run a little bit more than if you went to the grocery store and bought dried beans or dried lentils or frozen fruits and vegetables. So think about what's going to work best for you. A lot of times, to get you started, you may want to invest in pre-prepared salads that you can buy at the store or pre-cut up fruits and vegetables. So that way you've already got a good start. You're not having to prepare things. A lot of times what I do is I spend the weekend prepping my food. So if I know I'm going to have an egg omelet every morning, I'll chop up all my vegetables ahead of time, and that way it makes it easy for me to make my omelets in the morning and get up and go. Now, you may not be an omelet person, you might be an oatmeal person, so you can also do the same thing. You can crock pot on the weekend a large portion of oats and then just put it in the fridge, and every morning you take out a quarter cup, drizzle a little bit of cinnamon or put a few berries on there, and that can be breakfast for you. So you can also make things in bulk to make food prep a little bit easier. Let's see, what else did they talk about? They talked about how, one plan doesn't fit all. And remember that it's not a diet, it's a way of life, right? So you don't want to go on a diet, binge for a while, starve for a while, plateau, and then start eating normal food again and then gain back up again. That's what happens to everyone. They go on a binge diet, they say they're going to detox, or they follow somebody online who's doing a detox for a short period of time, or a keto cleanse. And then what ends up happening is you lose all the weight, but you've really not sustained any kind of good behaviors. You've just rebounded back up to your old state again. So find a plan that works for you. You might be here and you may want to be here. Maybe you just go here. You just add those vegetables in at lunchtime, or you add those vegetables in at dinner, or you add that piece of fruit midday, or you substitute that water, or you cut back on the amount of treats that you set aside for yourself, or maybe you reduce the number of times you go out to eat. So remember, it's not about an all or nothing. Sometimes we have to work towards good behaviors. And don't punish yourself, because again, punishing ourselves puts us in a bad place. All right, so what else do we have here? I think that's pretty much everything from the report, and I wanted to talk about the different plans and how I felt about that. My intention is not to push any one diet. It's just to educate you on what's out there, evidence-based, and so it's really a good way to kind of keep a variety. Look at the plans that you feel are best for you and your disease state. Find foods that you would be comfortable eating for the rest of your life, and then implement that. Alice has a question here. She said, kombucha, is it safe? Does it help with overall health? Homemade, not store-bought. That's a really good question. She said, I really have trouble with veggies. I need to work on it. Yes, of course. We all have our own crosses to bear when it comes to nutrition. I myself can confess that I love sugar. And so that is really my vice. And it's something that I work on every day. Okay, so getting back to kombucha. So I personally am a big fan of fermented food. Not everybody likes fermented food, but I'm one to make my own sauerkraut. I've made my own kombucha, fermented vegetables. I love miso soup. I love tempeh, which is fermented soy, and I cook with it often. But it's not for everyone. So what should you know about kombucha and safety? It's a gelatinous SCOBY, or a mass, that is a live culture. And if it's not kept or stored properly, it can breed bad bacteria. You can see that pinkish yellowy slime that forms on top of your drink. That's probably not really the healthiest. So it's really important to keep it in the fridge, prepare it correctly, get a SCOBY from a really good source, and trust that you are making it in a healthful way. If it looks slimy, it looks pink, it tastes fested, I would say throw it out. So you just have to be careful with fermented food. It lasts in the fridge, but not forever. But as it continues to grow in the fridge, it changes every day and it becomes even more and more healthy for you. So why is the kombucha or sauerkraut good for you? For those of you that don't know, our gut is full of bacteria that help us with digestion, help us with inflammation. They help us with neural connections and mood. It helps us with our immune systems. And when there's disruption in our microbiome, it causes gut issues, causes colitis, causes autoimmune conditions, causes recurrent infections, has also been shown to cause heart disease. And so the gut bacteria is a really important part of our health, and feeding that gut bacteria and growing that gut bacteria is a really good way of staying healthy. So thank you for that question, Alice. That was a good question on probiotics. Now, that wasn't addressed in any of the diets, which was kind of interesting. They did not talk about fermented food, Asian foods, or any new alternative ways of staying healthy. Okay, well, I hope you all, Crispina says, thanks, eat real food, grow food in your garden. Hey, good pin right there, Chris. So just for you guys that are listening, we have an event on next Saturday from 3 to 5 p.m. on January 20th. It is chocolate and music in the garden. And we have a tremendous program set up with raffles and giveaways. We're even going to be raffling away a raised bed for a year. You'll get to tour the garden, see what we're growing, and maybe join the garden and grow something for yourself and start the new year with a healthier you. So thank you for joining me this morning. Just make some comments. Let me know if you have any further questions. I'm happy to answer them. I'm going to try and see if I can switch my time to Saturday mornings since this seems to be a better time for most people. Okay? Have a great day. Goodbye.